I'm going to rotate your foot now. Tell me if this is painful.
Yes, right there.
You may feel fine at this exact moment, but small clots may already be forming inside your leg veins. They do not cause pain at first. They give no clear warning. Step by step, they weaken the vessel walls, cause swelling in the feet, and reduce the strength of your muscles. The most worrying part is this. Millions of people in Portugal live with these changes every day and do not realize that everything begins with circulation that is slowly failing. I am a medical doctor. After many years working with people over 60, I learned a difficult but important truth. Most problems in the legs do not start with old age itself. They begin with silent nutritional gaps inside the cells. Today, I will explain 4 key vitamins. When used correctly, they can support blood flow in the legs, help the body dissolve microclots, reduce swelling, and restore strength to tired muscles. All of this is possible through natural mechanisms of the body. I invite you to stay with me until the end of this explanation. The information you will hear is rarely discussed during short consultations. Before we move on, I also encourage you to write in the comments. From which city are you watching? And what time is it as you listen? I am genuinely interested in knowing where you are and how you feel today. Please take a calm breath. Let us begin. The first vitamin we will discuss can change what is happening inside your veins even now, while you read or listen. There is a risk that many people do not recognize. When the body does not receive enough niacin, the blood tends to lose its natural fluid movement. It becomes more viscous and less able to pass easily through the vessels. The legs are usually the first area where this change becomes obvious. A short walk begins to cause burning in the muscles. Climbing a few steps feels more difficult than expected. Many people say, "This is just my age," when in fact it is often a typical sign of a deficiency in this important vitamin. One of my patients was a 67-year-old man from Aveiro. He could not walk for 10 minutes without a sharp pain in his calf. He was convinced that this discomfort was simply the result of getting older. His medical tests, however, told a different story. They showed stiff arteries and very low niacin levels. We adjusted his meals and added natural sources of niacin. Within 3 weeks, the change was remarkable. He walked with less pain. The burning decreased. The tingling that had bothered him for years began to fade. Niacin is effective because it supports several functions at the same time. It can help lower LDL cholesterol and increase protective HDL. It reduces inflammation in vessel walls and promotes smoother circulation. As blood flow improves, many symptoms improve together. Skin color becomes more uniform. The feet feel warmer. Walking becomes more comfortable, and the muscles feel stronger and more stable. Patients often describe the sensation as if their legs are finally able to breathe again. Niacin also plays an essential role in the production of energy inside muscle cells. With adequate niacin, the body can produce more ATP, the main energy molecule. Many adults over 60 who feel exhausted, weak, or constantly uncomfortable are, in fact, lacking niacin without knowing it. When this deficiency is corrected, they frequently recover a level of vitality they believed was gone permanently. You do not need complicated products to obtain niacin. Eggs, chicken breast, salmon, tuna, and almonds are practical and relatively affordable options. It is always advisable to prioritize food. High doses of niacin in supplement form may cause the familiar niacin flush, a temporary redness and warmth of the skin that some people find unpleasant. You may ask yourself why some people experience heavy legs even when their test results appear normal. Often, the explanation lies in a process that is not visible on routine exams, but depends strongly on niacin. This vitamin is needed to produce NAD+, a molecule that allows muscle cells and blood vessel cells to generate energy efficiently. When NAD+ levels are low, the muscles function like a light bulb with weak power. They consume energy, but the response is poor. Blood moves more slowly. Oxygen does not enter the cells as it should. A deep fatigue appears, the kind many people interpret as just aging, when it is actually related to cellular energy. Niacin also activates enzymes that gently widen blood vessels. This helps the arteries in the legs open slightly, improving blood supply to the tissues. For individuals who suffer from cold feet, tingling sensations, or cramps while walking, this modest increase in vessel diameter can have a significant impact. Consider your own case for a moment. Do your feet remain cold even during warm days? Do cramps occur more often at night or early in the morning? These details provide valuable information about how your circulation is functioning. Another important aspect involves the endothelium, the delicate inner layer of the blood vessels. When the endothelium is inflamed, it creates resistance to blood flow, similar to friction inside a pipe. Healthy levels of niacin support a smoother and more flexible endothelium. This is like replacing an old, uneven road with a new, well-paved surface where traffic can move freely. I recall a 72-year-old woman from Coimbra. She woke several times each night with the feeling that her legs were shutting down. She described episodes in which her legs felt empty and weak. We reviewed her diet and increased foods rich in niacin. After 2 weeks, she reported that her feet felt warmer. After 3 weeks, her cramps decreased. After 4 weeks, she could walk again without needing to stop frequently. There was no miracle. It was simply her physiology recovering once the necessary nutrient was supplied. There is another detail that often goes unnoticed. When vitamin C intake is low, the walls of veins and arteries slowly lose strength. A useful image is that of an old brick wall, where the mortar between the bricks is falling apart. Swelling, purple spots, and heaviness in the legs are frequently attributed to normal aging, but in many cases, they are signs of small invisible cracks within the vessels. These structural weaknesses allow fluid to leak into surrounding tissues and cause swelling and discomfort. Something as simple as a lack of vitamin C can initiate this sequence. I recall a 70-year-old woman from Setúbal. By the evening, her legs felt so heavy that she compared the sensation to dragging bags filled with sand. The skin around her ankles had a purple tone. Minor effort caused her veins to stand out. When we analyzed her diet, we saw that she ate very little fresh fruit or vegetables. Her vitamin C intake was clearly insufficient. We introduced gradual but consistent changes: an orange in the morning, kiwi at lunch, and peppers and broccoli in the evening meal. The improvement came quickly. Within a few days, the swelling reduced. Her skin tone improved. The sense of heaviness decreased. Once again, the explanation was simple. The body responded as soon as it received what it needed. Vitamin C is vital for vascular health because it is required for collagen formation. Collagen is the main protein that gives blood vessels resistance and elasticity. Without enough vitamin C, collagen breaks down more easily. Vessels become fragile, lose their flexibility, and allow blood to accumulate in places where it should not. This can lead to swollen legs, a sensation of heat, persistent fatigue, and even restless legs at night. Many people never suspect that a basic nutrient deficiency may be responsible. Vitamin C also influences the endothelium. When this inner layer is inflamed, it behaves like a door that does not open fully. Blood has difficulty passing through. When vitamin C levels are adequate again, the door moves more freely. Circulation becomes more regular. The feeling of heaviness in the legs often diminishes. People whose feet feel colder as the day continues, or who notice their legs dragging in the afternoon, frequently present signs of endothelial inflammation. Another relevant function of vitamin C is its role in fluid regulation. Many older adults observe that their ankles swell at the end of the day. This is often related to small areas of inflammation that allow fluid to pass from the vessels into the surrounding tissues. Vitamin C assists in sealing these tiny openings. It strengthens vessel walls and reduces unnecessary fluid accumulation. For this reason, after only a week of proper vitamin C intake, many patients report less swelling and clearer, healthier-looking skin. Obtaining vitamin C is not complicated. Oranges, kiwis, strawberries, guava, red peppers, broccoli, and spinach are all rich sources. It is best to consume them fresh. Vitamin C is sensitive to heat and long storage. High-dose supplements can be useful in specific situations, but above 2,000 milligrams per day may cause digestive discomfort. For most people, food should remain the main source. Low vitamin C levels also explain why some individuals bruise easily or feel a strange pressure around the ankles at the end of the day. Every vessel is supported by collagen fibers that function like elastic cords. When vitamin C is lacking, these cords begin to weaken at a microscopic level. Blood then pushes against these fragile walls and escapes into the tissues, creating swelling and bruises. These signs can appear long before any major vascular disease is diagnosed. One patient, a 68-year-old woman from Porto, developed large bruises from minor bumps. After 3 weeks of increased consumption of vitamin C-rich foods, the bruises became smaller, the swelling disappeared almost completely, and she said her legs felt awake again, as if they had regained strength. Her body simply needed the correct support. Reflect for a moment on your own experience. Do your legs tend to swell by evening? When you press the skin near your ankle, does the mark remain for a few seconds? These are clear signs that collagen and vessel strength may be reduced. Vitamin C is the first step in rebuilding this structure from the inside. Once vitamin C levels rise, blood flow improves, inflammation decreases, oxygen reaches the tissues more effectively, and the body becomes more resistant to small daily injuries. The result is lighter legs, warmer feet, greater walking capacity, and often better sleep quality. Understanding the importance of vitamin C prepares us to look at one of the body's most delicate control systems, the balance between blood clotting and blood fluidity. That balance depends largely on vitamin K. There is a widespread belief that vitamin K thickens the blood. This idea is incorrect, and it can create unnecessary fear. Vitamin K does not damage circulation. On the contrary, it is a central element in the body's ability to manage both clotting and flow. It helps determine when a clot should form to protect you and when the blood should remain fluid to move without obstruction. When vitamin K is deficient, this regulatory system loses precision and hidden risks appear. I recall a 65-year-old man from Braga who was taking warfarin after a clotting event. His laboratory tests showed large variations. In some months, his blood was too thin. In others, it was too thick. He felt that the medication was failing. However, the main problem was his diet. On some days, he ate large amounts of spinach and kale. On other days, he avoided green vegetables completely. This irregular intake of vitamin K made his treatment unstable. After we explained that he did not need to stop eating vegetables, but should instead consume them in a consistent way, his tests stabilized. The body responds well when it receives a regular pattern. Vitamin K has two main functions. The first is to support proper clotting. Without sufficient vitamin K, the blood may fail to clot when necessary, creating a higher risk of large bruises or internal bleeding. With adequate levels, clotting is precise and efficient. It is neither excessive nor insufficient. The second important function is the protection of arteries against hardening. Vitamin K reduces the deposition of calcium in the vessel walls. Without it, calcium can accumulate inside the arteries and make them stiff. Many older people experience leg pain, cold feet, and constant fatigue due to this quiet calcification process. Very few realize that a lack of vitamin K is one of the contributing factors. Within this group of vitamins, vitamin K2 has special relevance. K2 activates specific proteins that remove calcium from the arteries and direct it back to the bones, while several medications aim only to slow the progression of atherosclerosis. Vitamin K2 helps prevent or reduce calcification from the start. For older adults, this can mean the difference between walking with discomfort or walking with relative ease. Natural sources of vitamin K include kale, broccoli, spinach, and kiwi, among others. I often recommend a morning green juice made from kale, apple, kiwi, and ginger. It is a simple way to support circulation and bring more vitality to the legs. It is also important to clarify a common misunderstanding. Patients who use warfarin do not necessarily need to eliminate green vegetables completely. The body still requires vitamin K. What matters is that the intake of vitamin K remains stable from day to day so that the medication can be adjusted accurately. Vitamin K is therefore not about making the blood thicker or thinner. It is about helping the body decide when to clot and when to keep the blood moving freely. It supports a kind of biological intelligence. Perhaps you have noticed that. With age, some people's leg arteries become stiff, almost like rigid pipes. Others develop leg pain, cold feet, or difficulty walking even though their cholesterol levels are not extremely high. In many of these cases, the explanation lies in a mechanism directly linked to vitamin K, and especially to vitamin K2. Arteries do not harden by accident. Inside them, there is a protein called matrix GLA protein, or MGP. Its function is to prevent calcium from being deposited in the vessel walls. You can imagine MGP as a guard whose job is to keep calcium in the correct place, the bones. However, this guard only becomes active when vitamin K2 is present. Without K2, MGP remains inactive. Calcium is then free to settle within the artery walls. Over time, the arteries lose elasticity. Their walls become rigid, and the blood must work harder to move forward. This leads to cold legs, cramps while walking, and the feeling that circulation does not reach the feet fully. This process explains why many older adults experience leg pain during walking, even though their test results appear relatively normal. Circulation can be impaired not only by cholesterol, but also by the stiffness of the arteries. By activating MGP, vitamin K2 helps the body prevent this stiffening and restore some of the natural flexibility of the vessels. One of my patients was a 74-year-old woman from Faro. She told me, "Doctor, my legs feel like old metal pipes." Her cholesterol was not very high. She did not have diabetes. Still, she suffered from pain during walking and frequent numbness. Our evaluation showed a marked deficiency in vitamin K2. We reorganized her diet and added more leafy greens, kiwi, and moderate sources of K2. After 8 weeks, the results were clear. Her pain reduced significantly. She reported that, for the first time in years, her feet felt warm at the end of the day. It was a subtle but profound improvement. Scientific studies confirm that vitamin K supports an efficient clotting system. It does not promote clotting in an uncontrolled way. Instead, it helps the body form clots only when necessary and avoid them when they are not needed. This protects against both bleeding and dangerous clots. Such balance is essential for individuals with varicose veins, chronic venous insufficiency, or a history of thrombosis. Think about your own experience again. Do your legs feel rigid at the end of the day? Do you notice a sensation of internal pressure when you climb stairs? These signs may indicate that your arteries need more support. Vitamin K is powerful because it does not focus only on symptoms. It acts on underlying causes. It helps prevent calcification, maintains the natural flexibility of the blood vessels, stabilizes blood flow, and works together with other vitamins. This understanding leads naturally to the next nutrient, vitamin E, which protects vessels from the progressive damage associated with oxidative stress. There is another silent factor that ages the arteries each day: free radicals. These are unstable molecules that attack vessel walls, weaken cells, and promote the formation of small clots. As we age, the number of free radicals in the bloodstream tends to increase. This raises the risk of leg pain, cold feet, a sensation of heaviness, inflamed veins, and slow circulation. Vitamin E is one of the main defenses the body has against this type of damage. I often remember a woman in her early 60s from Villarreal. At the end of each day, her legs were very cold. The skin around her ankles became darker. She experienced a strange sensation of electric shocks in her feet. These symptoms reflected inflamed and oxidized blood vessels. When we reviewed her diet, we noticed that very few foods rich in vitamin E were present. We included almonds, sunflower seeds, spinach, and 1 spoonful of extra virgin olive oil per day. In 2 weeks, her legs felt warmer. After 1 month, the shock sensations had disappeared. She said her walks felt lighter for the first time in many years. Vitamin E helps preserve the structure of vessels by preventing oxidative damage that reduces the elasticity of the arteries. A useful comparison is to think of arteries as garden hoses. If the hose becomes dry and damaged, it cracks under pressure. If it is protected, it bends and adapts to the flow of water. Arteries behave in a similar way when vitamin E is available in sufficient amounts. Another important function of vitamin E is the reduction of excessive platelet aggregation. When platelets stick together too much, they can form clots that are not needed. Vitamin E helps blood flow more smoothly, especially in the legs, where gravity already makes circulation more challenging. Many patients report that the sense of heaviness in their legs diminishes, as if a weight had been removed from around their ankles. Vitamin E also supports the production and preservation of nitric oxide, a molecule that relaxes and widens vessels. Greater dilation allows more blood to reach the feet. It also increases oxygen delivery to the muscles and reduces fatigue during walking. Rich natural sources of vitamin E include egg yolks, almonds, pumpkin seeds, sunflower seeds, spinach, broccoli, avocado, and extra virgin olive oil. Obtaining vitamin E primarily from food is usually the safest and most balanced strategy. It is important to underline a simple idea. Vitamin E is not just one more antioxidant on a list. It represents real protection for the cell membranes of the vessels. Without adequate vitamin E, these membranes suffer repeated minor injuries each day. With enough vitamin E, blood flow becomes more regular, more comfortable, and less likely to provoke symptoms. To understand this in more depth, we need to look briefly at what happens inside the cells. The walls of blood vessels are made of lipids, which are particularly sensitive to oxidation. When a free radical strikes these lipids, it sets off a chain reaction called lipid peroxidation. This is similar to a small fire that spreads through the tissue, weakens the vessel wall, and makes it stiff and fragile. Chronic inflammation of the surrounding area can then develop. Over time, this leads to classic symptoms: tired legs, tingling, cold feet, more prominent veins, and pain during walking. Vitamin E is the principal fat-soluble antioxidant that can interrupt this chain reaction. It inserts itself into the cell membranes and neutralizes free radicals before they cause greater damage. In practical terms, vitamin E extinguishes the spark before a large fire forms. When vitamin E levels increase, the vessel walls regain flexibility, circulation improves, and local inflammation can decrease significantly. I recall a 69-year-old man from Laria who described a sensation of pinpricks in his feet at night. His test did not indicate diabetes or advanced neuropathy. However, there were clear markers of oxidative stress in his vessels. We increased his intake of seeds rich in vitamin E, along with extra virgin olive oil and spinach. After a month, he reported that these pinprick sensations had decreased by more than 70%. He said, "Doctor, it feels as if my feet have woken up." This expression accurately reflects what happens when cells receive proper protection. Consider once more your own situation. Do your feet become colder at night? Do your legs feel tired after only a short walk? These are classic signs that the cell membranes in your vessels may be under oxidative attack. Vitamin E could be an important part of the protective support you need. Another noteworthy effect is that vitamin E helps maintain nitric oxide activity. Without sufficient nitric oxide, arteries become stiff, similar to old plastic pipes. When vitamin E is adequate, nitric oxide remains active for longer periods, permitting vessels to stay relaxed and to carry blood further, particularly to the lower extremities. When we understand these processes, one conclusion becomes clear. Vitamin E does not simply reduce symptoms, it helps rejuvenate the vessels at a microscopic level. For this reason, it is especially relevant for people with venous insufficiency, painful varicose veins, microclots, or legs that feel tired every day. After reviewing all these points, I would like you to keep one central idea in mind. Your legs do not age only because the years pass. They age when essential nutrients gradually disappear from your daily diet without being replaced. Niacin assists your blood in flowing more easily. Vitamin C strengthens vessel walls. Vitamin K preserves the balance between clotting and fluidity. Vitamin E protects cells from the wear of oxidative stress. When these 4 vitamins act together, the body can recover a degree of harmony, and circulation can become more active again. It is equally important to remember that each person is unique. Everything discussed here is educational in nature. It does not replace a personalized medical assessment. Please use this information as a guide and not as a diagnosis. Always consult your doctor, particularly if you have heart disease, diabetes, use anticoagulants, or experience persistent symptoms. Your body deserves attentive evaluation, monitoring, and care. There is one more message I would like you to carry with you. It is never too late to make progress. Even in your 60s, 70s, or 80s, your cells are still capable of responding. Your vessels can still repair part of the damage. Your circulation can still become stronger and more efficient. Aging is not a final sentence. It is an ongoing process. Processes can be guided, moderated, and supported with informed choices. You are not alone on this path. My purpose is to provide guidance, clarity, and encouragement, and to remind you that there is always another step you can take in favor of your health. If this video or text has helped you understand your body better, brought you some comfort, or given you hope, I kindly ask you to leave a like, subscribe to the channel, and share your experience in the comments. How are your legs today? Did you learn something practical that you feel ready to apply tomorrow? I read every comment with attention because your story is important. Your health is important as well.